Hello, my name is Prajakta Yadav. I am a student of Ritsang Training Center. Today I am going to discuss a technical topic about pediatric pharmacovigilance. So let's start with the topic. Pediatric PV refers to the monitoring, assessment and prevention of adverse drug reactions and other drug related problems in children. As children are not just small adults, the way they metabolize and respond to drugs differs significantly from that of adults, making the monitoring of drug safety in pediatric populations critically important. Ensuring the safety of medicines used in children is a complex process that involves various aspects of clinical research, regulatory activities, and post-marketing surveillance. Importance of pediatric PV. Differences in physiology. Children are a diverse group that includes neonates, infant children, adolescents. Each stage of development presents unique challenges when it comes to pharmacokinetics and pharmacodynamics. The liver, kidneys, and other organs that are involved in drug metabolism are immature at birth and evolve over time, affecting how drugs are processed. Thus, drugs may behave differently in children, which increases the need for specialized monitoring. Lack of clinical trials in children. Historically, many drugs have been developed and tested primarily in adults. Clinical trials in children have been limited due to ethical concerns, difficulties in recruiting pediatric patients, and the complexities of conducting such studies. Consequently, drugs that are prescribed to children may not have been tested in this population, and their safety and efficacy are often inferred from adult data or based on limited pediatric trials. ADR in children. Children may be more vulnerable to ADRs due to their developing bodies and differences in drug metabolism. Additionally, pediatric ADRs may not always present in ways that are similar to adult reactions. For example, symptoms might be more subtle or manifest atypical ways, requiring specialized knowledge to identify and manage. Challenges in pediatric PV. Underreporting of ADRs. One of the major challenges in pediatric pharmacovigilance is the underreporting of ADRs. Parent, caregivers, and healthcare professionals may be unaware of the need to report ADRs, especially if they are mild or not immediately perceived as related to medication. Moreover, many ADRs in children may be mistaken for the natural progression of the illness being treated, or they might not be recognized as being caused by the drug. Variability in pediatric population. The pediatric population is not homogeneous, and there are significant differences in how different age groups, example neonates, infants, toddlers, children, adolescents, respond to drug. For instance, drug dosage and formulations often need to be adjusted based on the age, weight, and developmental stage of the child. Pharmacokinetic and pharmacodynamic differences can lead to variations in drug safety and efficacy. Ethical and practical barriers to clinical trials. Pediatric clinical trials face both ethical and logistical challenges. There are concerns about exposing children to experimental treatments and recruiting participants for pediatric studies is often difficult. Consequently, there is often a layback of robust, high quality data on the safety and efficacy of medications for children, which makes PV even more important to detect ADR. Limited pediatric specific reporting system. While regulatory agencies and healthcare providers have systems for reporting ADRs in general, there are often limited focus on pediatric specific issues. The data collected may not always distinguish between ADRs in children and adults, making it harder to identify patterns that are specific to the pediatric population. Regulatory framework and pediatric drug safety. The regulation of pediatric drug safety is governed by several international and national bodies like FDA, European Medicines Agency, that is EMA, WHO. Following are following are the Following are the regulatory frameworks and pediatric drug safety which ensures the safety of a drug. Key, aspect, Key aspects of pediatric pharmacovigilance: post-marketing surveillance, signal detection, signal detection, risk minimization strategies, and education and awareness are the key aspects of pediatric pharmacovigilance. Today we discussed about the pediatric pharmacovigilance. Thank you for listening.